Everyone, my name is Shri Patel. I'm from India Home. Today's webinar is ensuring access to accurate and timely information. I'd like to take a few moments to encourage everyone to write their name and organization name in the chat. And if you are able to, please turn on your camera. For our agenda, we will first introduce our team and provide a brief overview of our organization. Then we will discuss our lessons learned throughout the years, highlight successes, and dive into key components and strategies. After, there will be an interactive activity where Victoria and I will walk through a scenario and work with you to analyze existing products from credible resources and provide some insights on how to make that information more accessible to community members.
Hi everyone, my name is Dilla Froze. I am an outreach supervisor at India Home. I'll be going over the timeless portion of this webinar, as well as monitoring the chat for any questions, comments, and concerns.
Good afternoon, everyone. My name is Victoria. I'm a community health worker with India Home for a little bit over a year. I work on a lot of the vaccine education initiatives, and I'm also currently in graduate school for my Master's of Public Health and Epidemiology. Looking forward to talking about providing accurate information.
Just to reintroduce myself again, I'm Shri Patel. I'm a data analyst for India Home. I have been at India Home for around a year and a half now, and I'm also currently in graduate school to get a master's in public health. I work on a lot of the data related aspects of India Home's various grants, and I ensure our team meets various deliverables for these grant funded projects. So I'll explain a little bit about our organization. India Home is a nonprofit organization that specializes in improving the lives of South Asian seniors throughout Queens. In recent years, our team has expanded to outreach work in the greater Queens area. These outreach efforts have been geared towards the general population with an emphasis on connecting community members to social services, COVID-19 testing, vaccination, and other social services. Our current outreach efforts have allowed our CHWs to reach a wide range of community members within the New York City area. And it helped us establish India Home as a trusted community-based organization. Efforts have focused again on helping priority populations with timely COVID-19 and flu vaccination uptake. That has been our main priority at the moment. And we also focus on various health equity based projects to help address disparities that the New York City community faces. In 2023 alone, over 900 seniors were served, and over 7,000 vaccine and healthcare literature was distributed to over 5,000 community members. This has all been done thanks to various grant-funded projects India Home has been awarded. Without funding from and resources provided from the CDC, Department of Health, NYU Langone, and other various funders, our CHWs and our team would not have the capacity to engage community members and distribute health information as well as provide educational sessions. So now I'm going to hand it over to Victoria to discuss more about lessons learned, successes, challenges, etc.
Thank you so much, Shri, for the introduction. And yes, I'm just going to talk about, in terms of providing accurate information. As far as our lessons learned, I do want to start off by saying that Queens has some of the most English language learners in New York City and in the country. So we've learned that with COVID-19 resources from the city, for example, they contain directly extensive jargon that make it really difficult for people to understand. So we've learned that translating and simplifying the flyers ourselves, doing things, even making like fonts bigger, for an example, it can help bridge the language gap that we found. We've also learned that in order to gain more trust from the community, being at food pantries as a CBO on a regular basis helps establish a presence. There's sometimes a lot of long lines and wait times. So going to food pantries a lot, showing up consistently is a way to form a more personable connection. And as far as what hasn't worked in terms of providing accurate information, I can say COVID being the first topic of discussion. You want to kind of find out what areas in their lives that they're feeling they should need more help in. Start a discussion around that. For example, ask people how they're getting ready for the winter rather than inquiring about their vaccination status on the spot. Some successes in terms of providing accurate information, I would say would be at one of India Home's favorite places to go, the Calvary Missions Food Distribution Center in Richmond Hill, Queens. We have a success story here because we visit this pantry multiple times to establish ourselves as a trusted neighborhood CBO. At the first outreach, we were unable to meet the language needs at first. But at the following outreach, we were able to address the high traffic flow among Bangladeshi community members. And we did this by providing India Home created flyers in Bangla around vaccine hesitancy and healthcare. The team was actually remembered by a community member, and she thanked us for having the translated flyers. So this was a positive experience, and it did show that we do need to pivot sometimes depending on what diverse community we run into. So yeah, when she thanked us, I would consider that a success because she remembered that, you know, we were coming back with flyers in her language. And on those flyers, it did include a Bangla speaking staff member, their contact information on how to schedule vaccine appointments. Another success would be at another food pantry that we go to in Queens called Our Lady of Light Food Pantry. In terms of getting community members the information that they need, we used tailored messaging, meaning we use messaging that's specific towards a certain point around COVID-19 and this specific community, which was a lot of older African American adults. We wanted to emphasize to avoid getting sick as much as possible because it's expensive and it's time consuming. And time and money is something that community members we work with, especially in this area, is something that they can't afford to miss. It can be a huge burden on them. So we want to emphasize you want to stay healthy. With that, we actually also use easy to use terms. So for an example, we did meet a man that at this pantry that was considering receiving an updated vaccine. You know, he saw us with some of the COVID-19 information and was like, "Oh, I do want to get it for my PCP, but I'm nervous because of all the prior doses." So we did use our tailored messaging and we did explain in easy to understand terms that the COVID-19 strains are continuing to change. Thus, neither his booster dose from 2022 nor his previous ones will protect him against the versions that are currently in circulation. We also explained due to his age, he ought to maintain getting vaccinated to increase his protection at all times. And we consider this a success story because at the end, he did thank us for providing the info in a way he could comprehend, and he was encouraged to make a vaccine appointment after. Of course, with successes do come challenges. Overall, community members are experiencing COVID-19 fatigue. Um, there's confusion on vaccine updates. People are hesitant on wanting to get boosters due to being unsure about whether their old boosters and doses are still offering protection, as demonstrated in the previous example. And this is usually also because they believe they were given too many doses of the vaccine. So that's definitely been a challenge, as well as the language barriers. There is a necessity. There's not much of a feeling to be up to date. That necessity is not so much there. People are feeling like they've done enough, and then you also have to deal with the misinformation that makes people unwilling. This misinformation can include hearing things like that vaccination causes death, or even cause people to contract the disease. Sadly, people feel that after having COVID-19, they feel that that's a sufficient defense within itself. Like, oh, I've had it, so why do I need a vaccine? My body should already know how to fight it. There are also questions on a few occasions if it's safe to get, vaccinations, COVID-19, if they're pregnant. And trying to learn how to make the science of transferring antibodies to developing fetuses easier to understand for the people that we work with is very, very difficult. So these are some of the challenges that we definitely run into in providing accurate and timely information. But we did want to show some examples of how we simplify real-time guidelines and information from departments of health's incredible sources. So, for example, we actually did create a Q&A to address concerns of already having too many shots. This is the India Home version, and it summarizes how the shot is updated. I like to use quotations like updated and provides the newest event defense. We like to use this kind of language. We feel it's more concise in comparison to compare the old vaccines to the new vaccines. It does encourage the new version. We feel that using terms like this is a bit better than verbiage used on the CDC website. For example, they definitely use the word bivalent to describe the old boosters a lot, lineage to differentiate between old and new strains. We just feel that those words are a little bit difficult, so in creating a Q&A, this is why we like to use certain language, kind of simplify it and let people or try to help people understand why it's important to maintain a vaccine schedule in an easier way to understand. And the next example to kind of go off or reflect based on using socioeconomic points as discussion first rather than COVID-19, we do have something called a needs assessment. We created this actually following a credible screening for New Yorkers, but that credible source of screening was actually very voluminous in terms of the questions. So we condensed the questions, kind of made them into groups. For example, housing is kind of just one question within itself. And that way it's easier to translate as well. Therefore, we can go ahead and screen our community members as well. Of course, in a needs assessment, there are questions about, COVID-19 vaccine history, but we did put that all the way at the end.
Thank you, Victoria. I'm just going to go over the timely information portion now. So in addition to delivering accurate information, it's also essential for us to provide timely information. So this is especially important when it comes to urban areas as they're densely populated and lead to quicker transmission rates. Our organization is based in Queens, New York City, where there's a large presence of immigrant communities and individuals living in multi-generational households. So this can be grandparents living with their children, and then those parents living with their children, and so on. So also the utilization of public transportation is common, where many of the individuals cross paths with one another. Another reason as to why it's important is that we come across priority population groups in the field where there is a need for equitable and accessible support. A story from the field was when we met a woman who had questions on the effects of the COVID-19 booster and what it would have on a pregnant person. Unfortunately, we didn't have the information at the time on hand, nor was there enough information out there for us to be able to promptly follow up with her when we got back to the office. So this then leads to there being a delay in the deliverance of information. So what's worked for us? Having consistent communication channels have been fruitful. Having weekly check-ins with the New York City Health Department where there are meaningful talking points. Talking about work we've done in the past can elicit ideas and questions for the future. Attending community-led forums where the community-based organizations present their past work and then give other CBOs the opportunity to network and ask questions. When a challenge is shared, several creative solutions are given from the members present from different organizations. What else has worked for us is consistent resource sharing. So attending weekly forums led by the New York City Health Department that brings CBOs together to provide them with information that better equip them for the field. And then they also provide a platform for the CBOs to address any questions, comments, and or concerns. In addition to the forums, weekly newsletters, email blasts from the health department that provide up-to-date information like transmission rates, they're key to interacting with the community. Our proposed solutions for addressing timeless effectively is to strengthen the feedback loop between the health department and the community-based organizations. This can be done by leveraging and promptly equipping the CHW workforce. They're the ones primarily delivering this information. Another method is proactively seeking CHW feedback. They have so many stories from the field that can give the health department some insight as to what's going on in the community and in the community members' lives. So we'd like to hear a little bit about your thoughts and the methods of addressing timeliness effectively, or like any challenges that you've had on your end with strengthening that feedback loop with the CBOs. So if you want to use the chat or you want to use the raise hand function.
Also, feel free to unmute. We want to have an open discussion. So if you have some thoughts, challenges, or any ideas on addressing timeliness, please go ahead and unmute yourselves and we can have a conversation.
So just to refer back to the last example where we had that pregnant woman asking for the information and for that information to not be out there. Um, One solution that we've had was that I've reached out to our partner coordinator for one of our grants and told her about the situation. And she was able to note it down. And when the information came out, let's say like a month or two later, she did follow up. So we were equipped with it for the future. Even though in the past we weren't able to have it for that community member, we were equipped well enough for the future. So that's one way where, it's a two-way street. So us reaching out, asking for it, and then receiving it from the health department is what's worked for us. So that's why we were just asking like how on you guys' end, what some of those troubles can be. I know that you guys have to go through a lot of these verifications. You guys have to send things, send a slideshow to be approved before you can send it out. I know those are sometimes a little difficult, especially when working with CBOs. So we were just wondering. I think we can move on.
Okay, no worries. So thank you so much for sharing that information, Victoria and Bill. We will now begin an interactive activity that will demonstrate how our CHWs have simplified a CDC flyer to ensure community members have access to accurate and timely information. We ask for everyone to turn on their cameras and raise their hands when they have a question or response, as this activity in particular is essential to have audience members participate. Please just give me a few moments to reshare my screen. It should take just a few minutes. And then Victoria will lead the next portion of our webinar here today.
All right, great. Thank you, Sheree, for sharing. Okay, I'm actually really excited to go over this exercise with you guys. So right here, what we have is actually what we would consider a credible source. This is a flyer from the CDC that has the recommended updated 20 to 23, 20 to 24 formula COVID-19 vaccines for people who are not moderately or severely immunocompromised. Thank you for zooming in, Sheree. So this is a mouthful of information here on this flyer. And like I said, this is what we would consider to be a credible source. I want to know what you guys think. What do you think would be challenging as a community member to understand about this flyer? Shree's going to scroll down it so you guys can get a good look at it. So while you're looking, I want you guys to really think, just because as a CBO as well, this is something that we may get and have to explain to a community member. So if you're a community member and you got this, what do you think would be hard to understand about it? I want to hear some of your thoughts. I'll get started. I'll say something. It's funny being in school for science and stuff like that. They have the measurements of how much dose you would need, 0.5 milliliters. Personally, for me, if I was a community member, and I am a community member, even though I work in this field, that's something I wouldn't I would be very confused if I saw that. I would have more questions. Um, what does that mean?
So we have in the chat, Shatima shared, the flowchart format can be a bit confusing.
Definitely.
And Becca, I believe, agreed.
Yeah, right? Got all the arrows. Different colors, got the yellow and the green and blue and yeah. Small fonts on the side.
I think also from part of uh, considering you guys deal with a lot of the immigrant community, I think I would be straight up confused with the whole flyer in general. Like what dose to take, how many doses do I need, all that stuff.
Yeah, definitely. Thank you, Devinder. Exactly. Based off everything we said in the beginning of the slide, in a place like New York City, uh, get something like this, you'd be like, what?
I believe Becca wants to share. Go ahead, Becca. You can unmute yourself.
Hello. Kind of going off of what Devinder said, if I was not super educated on the doses, I would think I need all of these. And that would be very confusing, kind of worrisome because it's like, oh my gosh, why do I need everything?
Yeah, it's a lot. It's a
Yeah.
lot.
And then I was agreeing with your the measurements as well. That was probably the first thing I noticed. It just is a little irrelevant to the public. Because then it just brings on that, well, did I even get that much? I don't know
Right.
what they gave me when I got my first dose. Like, do I have enough? Not enough. So
Thank you, Becca. Yeah, I'm not gonna lie. If I was being vaccinated, I'd be staring at the little vial that they have extra close. I'd be like, what does that say? Does that say what it says here? Yeah, definitely.
It's not like, you know how a lot of diabetics have insulin to take home and they adjust their measurements? It's not even like that. So I guess it does add to the confusion.
Definitely. Thank you all. Yeah, that's pretty much what we felt too. We were actually shown this from our local health department. So I was kind of just like, it's got to be an easier way to show the guidelines. The whole point is that the CDC was trying to get out is what up to date means, basically, in terms of how many vaccine doses. So with that, Shri, you can go to our little draft that we created. Okay, perfect. So this is a draft. When India Home creates its materials, we obviously compare based off the credible sources. Now, I know it's interesting you did say the flow chart. We did kind of keep a flow chart sense, but I will go into more detail of how we still feel like we were able to make it a bit easier. Do you think you can still understand what this is trying to show, summarize what this is trying to show in terms of doses? I want your feedback. This is easier to understand. Much easier. Thank you. Yeah. Because what the source is supposed to summarize is accurate vaccine information for non-immunocompromised individuals. The main goal is to get out whether, what you need based off previous doses, based off your age, and based off what manufacturer. So that's Moderna or Pfizer or Novavax, for example. Is there anything that you think we missed that we could have done to make it more accessible? Or even on the old CDC one as well. What do you think they could have done to make it more accessible as well? Definitely want to hear your thoughts on that. I know you guys said this is much easier. Yeah. Okay, sure. You can go to the final version. Oh yeah. So this is what we would actually show to community members if they wanted something to take home that would help them show what they need based off what they've previously had. So I'm going to explain the changes made, and then we're going to continue the conversation a little bit. So as far as changes, as you can see the title, instead of saying recommended, we just share what up-to-date means to help eliminate the confusion. We felt like the title was pretty wordy. As for the ages, the guidance for 5 to 11 and 11 plus is actually the same. The only difference is the 6 months to 4-year-olds, which is why that has its own, and Ashri is showing now 5 years and older has its own. Basically for that, what we're trying to say is it doesn't matter how many previous doses you were taken, or you have taken, you just need one shot to be up to date if you're in this age category. We put the definition of what unvaccinated versus vaccinated means. That was on the side originally on the CDC flyer. But here we have it under here. Remember how we said we run into a lot of community members that are unsure of like the dosages and what they need. Well, now we have it here. For unvaccinated, that means you've had no doses of COVID-19 in the past. Versus vaccinated, you've had previous doses. It doesn't matter if it's been 1, 2, 3, 4. It doesn't matter. You have been vaccinated with a dose at some point in time. And we put that down to show that you just need one updated shot of Moderna and Pfizer. We did put the Novavax reminder and how many shots needed on the bottom instead. And this is because, which I'm going to go away, I'm going to go over this in the key takeaways part. It all is up to your audience and who you're trying to talk to. So for India Home, who we speak to, a lot of people don't have Novavax. A lot of people don't have the allergies to Moderna or Pfizer. We get a lot of people that have had either Moderna, Pfizer, or J&J. So they want to know, is it okay to get Moderna and Pfizer if I've had it vice versa in the past? So we also did put like a little disclaimer to get medical advice, speak to a medical professional. We always like to say that because, you know, everybody's body's different. Everyone should always talk to their doctor as well. That's always a credible source. We did do less arrows, kind of just one going down to what you need. And to make it easier for people to understand that regardless of what manufacturer or amount of doses you've had in the past, at least one shot, if you're 5 or plus or immunocompromised, is needed. If you're 6 months to 4 years, sorry, Sharif, you can go back up. It could vary a little bit, but you see we have plus. So instead of including all on it, like if you had 2 doses of this, you need one of that. Or if you have 3 doses of this, you need one of that. Just the same thing. Basically, you've had 1 or more. So that's why we say if you have 1 or more of Moderna, you just get 1 shot. If you've had 2 plus, 2 or more, you still just need 1 shot. So this was kind of our thinking going through it to make it a bit easier. I know we did have someone in the chat say that it looks a lot better. Thank you, Becca. So that was kind of our goal. You can go to the side by side now, Shri, and we can continue our conversation. Yes, yes, yes. So this is how we felt we could make the credible source more simple, still showing accurate information, still matching the current guidelines. This was India Home's thinking, you know, changing up the colors, changing up the fonts, using more simple language. But I want to know, again, if you're a community member, which source is easier to visualize? I would say ours. I'm not being biased because we made it, but I would say ours. Anybody have any other thoughts on which one they think is easier to visualize, or definitely on the right. Thank you, Devinder. Yeah. Is there anything you guys would do? Even with our version, please feel free to give feedback on that too. It's an open discussion. We're all trying to figure out together how can we make information, credible information easier to understand. You work mostly with parents, and the right side would be much more appreciated and understood. Very nice. Thank you, Becca. Yeah, we work with parents too. We actually do educational sessions at schools in Queens. We're actually having one in February at a elementary and middle school. So when explaining what up-to-date means, you know, I wouldn't be surprised if they were interested in seeing something like this. Yeah. But definitely feel free to unmute if there's anything else. Is there anything you think that we missed? Do you think we maybe should still include that this is a 2023 to 2024 formula? Or anything like that?
I guess just to maybe explain, like, this is as current as what I think the new dosage came out, what, in 2023 of September or
Yes.
October, that, or, and then maybe you guys already do, but the pre-existing conditions, just to maybe explain that.
Right. Okay. So for people who do have pre-existing conditions.
Yeah.
Right. Yeah. Maybe include that on here as well. That population would definitely feel a bit left out with the flyer like this. Yeah, I was
Other than that,
shocked.
it's pretty strict. It's really strict.
Awesome. Thank you, Devinder. Yeah, when they showed us this, the CDC version, yeah, they didn't have one that was for people who are moderately or severely. They always say, oh, they can take a little bit more shots, but people might be confused once again with the number of doses. So that's definitely something to take into consideration. Yes.
Something I just wanted to add is when I was doing the editing for this webinar, the CDC did actually come out with a version of this flyer here on the left for those who are immunocompromised. It looks very similar to the version that they came out with, but it came out almost a month after this initial one. So that's just something to keep in mind, is that the information wasn't necessarily given in a timely manner.
That's actually so interesting because the immunocompromised individuals are usually the ones that are encouraged to get the doses first or to have more doses. So it's interesting that that came out afterwards.
Yeah, that's interesting. Yeah. There we go with that timely information. I wanted to say actually when Dill was talking about that part, I wanted to mention also something that I feel like has been hard that India Home is still struggling with timely information is the cost. I know we have the bridge access program nowadays, but there's still a lot of confusion around that. So yeah, there's got to be a better way to kind of do that timely information.
So Becca says that she sees that we highlighted the date on the left one, but her suggestion would be just to add the date footnote to ours so that the recipients know when it was created, just to kind of have a paper trail.
You're right, Becca. That's a good idea. You always want to put the date that this stuff came out, kind of like cite your source kind of thing. Yeah, paper trail is important. If you get a community member that comes back to be like, you told me this was given now, and yeah, you don't you don't want to deal with that. Yeah. Thank you. Thank you, Becca. Very nice. So yeah, this was kind of our thinking. We kind of wanted to walk you guys through what we thought would make this more accessible and kind of get your thoughts on it. I really do like that our thoughts were aligning with each other. It was made that way for the stars. So thank you.
Thank you for going through that activity, Victoria. Really appreciate it. I will stop sharing my screen and reshare our slides again. We're going to come together for some key takeaways as well as questions and any last remarks that we may have. So please just give me a few moments. We'll resume very briefly.
Perfect. Thank you, Shri. So these are some of the key takeaways that we wanted you guys to take after this webinar. It doesn't matter where you're from, CBO, Department of Health, you have to meet people where they're at with language. You have to know your audience. Many individuals are unfamiliar with terms like mRNA, bivalent, as we saw in the last example, the vials. A lot of people don't understand that. To no fault of their own, but you do have to meet people where they're at. You can use terms like up to date to let people know which guidance is the most first and foremost important to follow at this time. Credible resources contain a lot of voluminous information like that CDC flyer, and it can be difficult to digest. We also wanted to, put out there that community recognition can help encourage trust and can help CBOs and departments of health be seen as a credible source of information. And finally, you want to strengthen the health department and CHW workforce relationships. That's the best way to get timely information out there. You want everyone to always be on the same page. So those are some of the key takeaways we wanted you guys to have. Does anyone have any questions regarding the webinar? We do have examples of talking points and stuff like that that we'll share with you guys. But in the meantime, do you guys have any questions? We can just chat, anyone here can unmute and maybe name some of the challenges that they've had to come see with providing timely and accurate info. I know, Becca, you work with parents, so that within itself, I would say, is a challenge. Parents are always concerned about what's best for their kids, and they want to know the answers right now. And in a pandemic, when this is a lot of people's first pandemic, there's a lot of unknowns, and a lot of waiting on needing to know what comes next. So I feel like that can definitely be a challenge with parents. Does anyone else have any challenges they run into or any questions about some of the things India Home does to face these challenges? Our partners have, oh, go ahead. Sorry.
Okay. Shatima says that our partners have communicated that getting trust from the community was a huge challenge.
Yeah, it's difficult. And I would say with New York, we are a melting pot, especially India Home's catchment area, Queens, very diverse. Every ethnicity and every race lives there. And what we found is that a lot of these people, there's a history of struggle, oppression, even among from like health departments and stuff like that. So a lot of people are attached to that history. Like, you've done this stuff in the past, why should we trust you now? That's definitely something we run into. People are struggling. The pandemic hurt a lot of people in every other aspect, which is why we like to start off with those social determinants. So you're facing financial ruin. The last thing you want to hear is someone telling you you have to go get vaccinated. Instead, you got to kind of be like, not push them, not say you should, but we recommend, being sick is timely, it's costly. This is new to all of us, including local departments of health and stuff like that. So you got to find ways to build trust. Like we said, we're always out there presenting the information. So keeping lines open with our local departments of health and with the community members. You just got to stay consistent. Is there anything in particular you guys have tried to do, or your partners have mentioned anything they've tried to do to gain more trust? I know for us, like we said, bringing translated material, which we'll actually talk about more in our other webinar. So stay tuned for that. We'll go into more detail. But that is one of the things you have to do, is translate it, but also translate it with intention. Make sure the dialect matches up, easier for them to read and stuff like that. Constantly being out there.
Does anyone have any final questions or concerns that they'd like to share?
The vendor says that timely and accurate in different languages is a big challenge. How do you ensure that happens within the communities you deal with?
That's a very good question, Devinder. Yeah, like I said, just being there. And I know it sounds cliche, but with a lot of communities in Queens, they're very tight knit and the routines kind of stay the same. So that's why we found that going to food pantries was very effective. You have to go to the source. And a lot of those people, they're always there. So when that community member recognized us and was like, you have something in Bangla this time, we were able to show her and give proof that we're here for you, that we want to make sure you have the information that you need. So that's definitely one thing that we do. Our next webinar will go into more detail about translating material. But right now, what India Home does is we do have certain talking points. I know for one, getting ready for colder weather, you want to give people a why. They want to know a why. Like, why do I have to do this? Why do I have to do that? Well, you can let them know, hey man, the cold weather makes us more susceptible to infections. That's why they call it flu season. So you want to make sure that your body is in its prime shape and it needs extra assistance. We don't say that vaccines are the cure-all. We say it gives your body extra assistance. So there's certain talking points and stuff like that that we have to use in the communities that we deal with. I hope that made sense.
Okay, we don't have any final questions. I just want to thank everyone for joining us here today. We really appreciate your time and participation in our first webinar. We will send out a follow-up email with the copy of the slides, the simplified flyer that we showed, as well as the talking points for conversations with the community members that Victoria had mentioned. I've attached our emails right here on the slides, so please feel free to email us at any time with any questions or concerns. Even if you may not have a question today, if one pops up in a couple of weeks regarding timely information, we will be happy to answer it. Further, we'll be conducting another webinar on February 1st on addressing language barriers that lead to misconceptions about COVID-19 and mistrust and low vaccine uptake. If you wish to join us, please reach out to us with a calendar invite and we will send that over. Thank you again so much and have a great day.